Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for choosing a contraceptive. Tip number 1. The first question to ask is, are you planning on having more children? There are both permanent and reversible options for contraceptive. If you are certain that you're not planning to have any more children, then the options are tubal ligation for women and vasectomy for men. All other methods we're going to discuss today are reversible. Tip number 2. Think about how bad it would be if you were to become pregnant. If you have an underlying health problem and you must avoid pregnancy, for example, then you might either choose a permanent contraceptive, which is highly effective, such as vasectomy or tubal ligation. If you're in this boat and you want a reversible method for contraception, then the most effective contraceptive that's reversible is either the intrauterine device, the IUD, or the rod, which is an implantable rod that releases progesterone and lasts for 3 years. Tip number 3. There are certain individuals with medical conditions who should not take a contraceptive that contains estrogen. The contraceptives that contain estrogen include the combined hormonal pill, the ring, and the patch. The following people should avoid these types of contraceptives: women who are age 35 or older who smoke, women with diabetes and a complication from their diabetes, either nephropathy, retinopathy, or neuropathy, women who are pregnant, women who have migraine headaches with auras, women who have breast cancer, ischemic heart disease or a valve disorder that puts you at increased risk for atrial fibrillation, a history of deep vein thrombosis or pulmonary embolism or stroke, history of subacute bacterial endocarditis, of prolonged bed rest, if you anticipate or have recently had a major surgery that causes prolonged bed rest, if you have a blood clotting disorder such as factor V Leiden, prothrombin gene mutation, etc., if you have pulmonary hypertension, a liver disease, or a tumor in your liver. There are other medical conditions where you should avoid a contraceptive that contains progesterone. These include the progesterone intrauterine device, the progesterone rod, and the progesterone-only pill. These women are women who are pregnant, women who have breast cancer or another cancer that's known to be progesterone dependent, if you have a DVT or a PE and are not adequately anticoagulated. The depot shot, which is a shot of progesterone that lasts 3 months, should be avoided in women who have had a fracture that's known to have been caused by osteoporosis. For women who plan to become pregnant in the next year, because it takes about a year to regain your fertility after the depot shot. And for women taking aminoglutathione. Furthermore, there are certain women who should avoid an intrauterine device. The 2 intrauterine devices are the copper IUD, or the Paragard, and the progesterone or levonorgestrel releasing IUD, which is called the Mirena. Women who should avoid IUDs are women with an active pelvic infection or severely distorted uterine cavity, such as from severe fibroids or bicornuate uterus. Tip number 4. Do you have a risk for a sexually transmitted disease? If you have risks for sexually transmitted disease, which include not always using a condom, having more than one sexual partner in the last 6 months, having a history of sexually transmitted infections, then the only contraceptive that can protect you is the condom, either the male condom or the female condom. And you should consider these 2 options if you fit into one of the categories I just described. Tip number 5. Do you have a cost issue? if your insurance pays for your contraceptive, then this isn't a concern. But if you're paying out of pocket and you're limited as far as what you can pay, then the three least expensive options are the copper intrauterine device, which costs about $600 and lasts for 10 years, a vasectomy for men, which costs about $700 and lasts a lifetime, and the progesterone intrauterine device, which costs about $800 and lasts for 5 years. The three most expensive options are the patch, which costs approximately $2,800 and lasts for over 5 years. The pill, which costs approximately $2,600 over 5 years, and the ring, which costs approximately $2,500 over 5 years. Tip number 6, think about what would work in your life. Are you able to take a pill every day? If not, then maybe the combined pill or the progesterone pill would not be right for you. Do you mind inserting something into your vagina every month? If not, then maybe the vaginal ring would not be right for you. Do you mind wearing a patch? If not, then the patch would probably not be great for you. And do you hate needles? If you do, then perhaps the Depo-Provera shot every 3 months would not be right for you. Tip number 7, how do you feel about your periods? If you like having your periods, then you should probably avoid the Mirena or the progesterone-releasing IUD. On the other hand, if you would rather not have periods and wouldn't mind occasional unscheduled bleeding or spotting, then you should consider the progesterone-releasing IUD. Over 50% of women who use the Mirena IUD will not have periods after a year. Tip number 8. There are certain medical conditions and contraceptives that have a benefit. There are certain medical conditions for which contraceptives have a benefit. So, if you have heavy or painful periods, then you should consider the combined hormone contraceptives, the pill, the patch, the ring, the progesterone IUD, or the Depo shot. All three of these options can reduce the amount of bleeding and reduce the amount of pain associated with menses. If you have acne or male pattern hair growth, such as on the upper lip or on the chest, then you should consider combined hormonal contraceptives, which reduce acne for cases of mild acne and reduce male pattern hair growth. Tip number 9. If you have specific concerns about cancer risk, then there are certain contraceptives that have a benefit for reducing the risk of cancer. Combined hormone contraceptives, the pill, the patch, and the ring, reduce your risk of endometrial cancer, of ovarian cancer, and perhaps of colorectal cancer. Intrauterine devices reduce the risk of endometrial cancer and ovarian cancer. And the Depo shot reduces the risk of endometrial cancer. Tip number 10, believe in yourself. You have what it takes to choose the perfect contraceptive method for you, balancing the benefits and the risks. And with this video, I hope you have a better idea of what would be the right contraceptive for you. So, good luck and have a great day. Thank you.